So we'll come back with the.
Exactly.
That's good information for us to have.
Uh-huh. And I'll tell you the capacity of this center, some things that we probably will need more money to do. One of the benefits of this is that I can virtually listen to calls. Or we have a small group of staff whose responsibility is to monitor calls. So for the first time ever, we can actually listen in on calls as they take place. So I think that's something that more people would like to see done. I was talking to a couple of judges about this, and they thought that that was outstanding, that you can actually listen to the call going in. That way, you know, we will know, okay, as soon as we need to do something different from what the intake worker said. And also with this, when someone complains to me now about I called in an intake and I said da-da-da, nothing happened, we can get a transcript of what was said on the call. Exactly, just like a 911. So this has really elevated the kind of work that we can do with this and can really improve our quality.
Well, nothing beats the TV commercial. I mean, as they buckle their seatbelt now.
Oh, yeah, that would be great.
But an inexpensive way to do it is our school counselors. Because we could ask them to disseminate the information. And they would be glad to do it. And kids read posters. When you put up a poster in a school, believe it or not, when we had those safe havens, when girls were abused or whatever, could go to a safe place to make a phone call for protection, that was well advertised by our counselors. Posters in schools.
That would be great. Right. And we're meeting with school social workers. I don't know which one. I know it's coming up. But
I got. When you advertise a service like this, you're gonna increase your
yes.
volume, and then you're gonna get calls that are not necessarily genuine calls. So how are you really prepared to do that and have the screen to screen those calls out appropriately? Is my question.
Right, and that's
Fine, but when you
yeah, they will call. Right, and we saw that happening in November, December. We went from getting about 1,500 calls a week to upward to 6,000 calls a week. And when you have a 1-800 number that's connected to human services, people call us for everything, you're right. So there are a number that we have to back out, that people want to know about Social Security, they want to know about things related to aging, where the nearest driver's license service is, or do I need to renew it? So yeah, that we do, and so we've kind of set up kind of a triaging there to be able to push those calls over. Also wanted to mention that Prevent Child Abuse Georgia, you know, they are setting up their line, so we're hoping to work a bit more collaboratively with them. So when people call us, there are some calls that really need to go to them, kind of just calls of interest. They also have calls that need to come to us. But you're right, that we will be handling more calls as we do that.
The other thing I wanted to ask, you say you have the ability to monitor calls. Do you filter that back into your training?
Yes, that is certainly what we will be doing, to filter back into our training of our staff as we hear these calls. These are the things that we're noting that you all are missing, that we need to do a better job of. These are the things that's really positive and we need to do more of. Right, so we will be putting that back into our training. Also wanted to mention with the predictive analytics, as I think about dollar signs, besides after we've completed the predictive analytics on those factors, we're going to be training our staff, but our goal would ultimately be to enhance our electronic case management system so that we build in this logarithm that says, as the reporter is giving us a certain piece of information, that behind the scenes it's actually creating kind of this profile for us, you know, parent under the age of 25, unrelated caregiver in the home, 3 children. So that's where we want to move to with the predictive analytics. That is not something that our workers need to be trying to determine, but the system can be intuitive enough that it captures that for us.
Before you talk about the privatization pilot,
Mhm.
if you don't mind taking 1 minute to, because I think there's a lot of confusion in the public about the governor's stance on privatization, and the fact that some people thought he was pushing the legislation forward and things like that. I think it's good for this commission to understand very clearly what the governor's position is on this and how this relates to the pilot going forward.
Yes, and there's been confusion about the role of the council related to this. There were a number of for people who thought the council was specifically focused on the privatization of foster care, which, as you all know, it is not. As Dr. Hill's getting ready to talk about, DFCS is beginning a pilot of privatization. Those of you who know the system know that it is already a public-private partnership. This is increasing the private side of that public-private partnership that already exists. It does not go as far as some in this room would like it to go, but it moves us in that direction. The governor's position generally is, we're all for public-private partnerships where they make sense, but in this case in particular, we have to ensure that children are safe. And he felt like we needed more information, and this pilot is our way of doing that. And so we'll pilot this in 2 regions in the state. We'll learn from this pilot, and from the pilot we may say, yes, this worked, and we need to move in this direction, and we need to move in it more aggressively, or, we need to tweak this, and we need to look at this differently, and, it works differently in different areas of the state. The other thing that we'll learn from this, I think, is how much capacity is out there within the private community to do the work that has been put forth from a private standpoint. Do we have entities capable, for instance, of kind of managing these systems for regions in the state? And that's still a question in our mind. And so we'll grow that capacity and see what capacity exists as we move forward with this pilot as well. So I'm happy offline to answer any questions you have, but I know Dr. Hill's going to talk about it more.
Right, and let me also say, too, that we met with the Department of Administrative Services this morning, and we are preparing a communication kind of a document that we will be sending out to all potential suppliers, which will be all, of our agencies here, as well as other key stakeholders, judges and others, so that you all will have an opportunity to review what we're talking about doing and make comments. May 16th, Diane, is at the meeting. We have our regularly scheduled provider meeting on Friday, May 16th. By then, you all will have received the document, and we will be talking about the document in greater detail. Because then you will have had a chance to look at it, review it, write out your comments and questions, and come back. So you will have the opportunity to really participate in what this looks like. And as she said, right, we're doing the 2 regions, and they were selected based on, we looked at these 3 things because largely it is a privatization of placements that beginning with the rollout of this, DFCS would not be monitoring, recruiting, or providing oversight to foster homes in these 2 regions. And so we're contracting for what we're calling a lead agency. So child comes into foster care, the DFCS case manager would contact a staff at the lead agency to say that this child has now entered care. It will be the responsibility of that lead agency to locate the most appropriate placement resource for the child. This gets us closer to some of the challenges that we've had. So number one, we have decreased the number of staff that we've had doing what we call resource development. So and Judge Walker mentioned the declining number of foster homes in her area. Part of this is that, right, we've lost some of those staff, so we were not doing heavy foster home recruitment anymore. So we're looking at really building up the pool of foster homes within those communities. Number 2 is really important, maintaining children within their counties or close to their communities, because we want children to be able to continue in their same school systems, maintain and preserve their connections is what we're looking for. Third thing we looked at was just the cost of transportation that was associated with children in foster care in these regions were really high. So again, very soon, hopefully in the coming days, we will have we will be sending the proposal out to you all so that you can weigh in on it and provide us with some feedback.
Dr. Hill.
Uh-huh.
Once these children will be gone to a lead agency, how involved, what would DFCS involved be after that point?
And we are spelling all of that out because DFCS continue to maintain the ultimate responsibility for what happens with that child. So we will continue to be very involved with lead agencies or the foster home, because we will still be visiting, my staff will still need to visit those children. Because at the end of the day, right, we still have the ultimate responsibility for ensuring the safety and well-being of children. Other thing I wanted to mention, right, we do have, we submitted an application for a 4E waiver, and these are the 3 target areas that we're looking at. We will be having some stakeholder meetings soon around this. We are proposing to use our 4E funding in a flexible way to target these groups. Short stayers was the first thing. Kind of came to this in consultation with the Administration for Children and Families, that as they looked at our data, they wondered whether or not this is an area that we should look at. Children in care for less than 90 days. I think I heard someone mention earlier that if they came into care for a short period of time, I think we had about 1,300 that was less than 30 days. So the question became, did they need to come into foster care in the first place? Because there's that added trauma to a child to have brought them into care if they didn't need to come in. As we analyzed the data, probably many of those children came into care for issues such as truancy, parents saying, I can't do anything with this child. We also had some children who were victims of sexual exploitation in this number. So we will be using those funds to provide community services for those children instead of bringing them into care. Providing community services for children who may be in a high-end congregate care facility to bring them down to something lower. Kinship Navigator Program.
This one I'll ask you just to highlight.
Okay. Highlight Kinship Navigator. Governor Deal asked us to put together a program that was really focused on kind of an ombudsman-like program for grandparents and other relatives, what we call kins. They may be godparents and others. So we are building a team of individuals who can work with parents, grandparents, and others to be able to navigate the child welfare system, the child support system, Division of Aging, as well as our Medicaid, child care, TANF, all of those. I was going to mention the virtual health record with the CMO. Our staff will soon have access to medical records about children in care. This is our initiative, Teens Are For Me, that we're going to really focus on, working with youth 18 to 21. This was a question that Senator Millar had earlier, and I've broken it down by the months in terms of the number of kids that we have in care. So again, over time, we should be seeing these numbers increase as if kids are remaining in care. So we are working on this July 1st. We're moving to what we call an opt-out. Right now, at the age of 18, we do sit down with our youth to ask them, you're 18 now, you can remain in care or you can leave. And I think many of them take the option of, oh, I can leave, and they leave. So what we're doing now is saying we won't be having that conversation about do you want to stay or go. If you don't have any place to go, we're going to make the assumption you're going to stay with us so that we can get you educated, get you job ready, get you connected before you leave care. What's going to really help us with the juvenile code, the House Bill 242, with the judges also have an oversight now of youth 18 to 21. We can use it as some leverage to say, you have to go before the judge. You need to talk about where you are, and they're going to be asking questions. So we're going to be doing that. And this is going to take a lot of finances that we really don't have at this time to do this one. This is where we're going to need some money for this one.
And I just want to highlight one thing on this one that Dr. Hill, this is a whole different, this is a paradigm shift for the agency, where we're saying you're not leaving unless you have a life plan to leave our care and custody. And so this is monumental. I can't overemphasize how monumental this is for the state of Georgia to say that we care enough about our kids that are 18 and above to keep them at home, to make sure they're taken care of, make sure they're going to school, going somewhere, getting ready to be self-sufficient.